Hey there, med students! Today we're diving into the world of the subclavian artery, one of the major highways of the human body. By the end of this video, you'll have a solid grasp of its anatomy and clinical significance. So let's get started. First up, origins. The left subclavian artery is the third branch of the aortic arch. It pops out directly from the arch after the left common carotid artery. On the flip side, the right subclavian artery branches off from the brachiocephalic trunk, also known as the innominate artery, which arises from the aortic arch. Now let's talk about their course. Both arteries travel laterally and superiorly on either side of the body. The left subclavian artery passes behind the left common carotid artery and curves laterally toward the upper limb. The right subclavian artery does something similar but originates from the brachiocephalic trunk. Here's a fun fact. Both arteries pass beneath the clavicle or collarbone, and when they hit the axillary region, they become the axillary arteries. Cool, right? Next, let's break down the branches. The subclavian artery has three regions of branches: the vertebral, thyrocervical, and costocervical regions. In the first part, before the vertebral artery originates, we have the vertebral artery, the internal thoracic artery, and the thyrocervical trunk. The vertebral artery ascends through the cervical vertebrae and enters the skull through the foramen magnum, forming the basilar artery. It's a major supplier to the brainstem, cerebellum, and parts of the spinal cord. The internal thoracic artery descends along the anterior surface of the thorax, supplying the chest wall, diaphragm, and mammary glands. It also gives off branches to the pericardium. The thyrocervical trunk is a short trunk giving off several branches. The inferior thyroid artery, ascending cervical artery, suprascapular artery, and transverse cervical artery. Moving on to the second part, between the vertebral artery and thyrocervical trunk, there are no significant branches. In the third part, beyond the thyrocervical trunk, we find the costocervical trunk, and sometimes the dorsal scapular artery. The costocervical trunk divides into the superior intercostal artery and the deep cervical artery. The dorsal scapular artery, when present, supplies muscles around the scapula, including the levator scapulae, rhomboid muscles, and trapezius. Here's a handy mnemonic for remembering these branches. Very tired individuals sometimes come home. V for vertebral artery, T for thyrocervical trunk, I for internal thoracic artery, S for superior intercostal artery, C for costocervical trunk, and H for dorsal scapular artery. Let's wrap up with some clinical relevance. Thoracic outlet syndrome involves compression of the subclavian artery or the brachial plexus, leading to pain, numbness, and weakness in the arm. Subclavian steal syndrome occurs due to stenosis or occlusion of the subclavian artery near its origin, causing blood to be stolen from the vertebral artery to supply the arm. This can lead to dizziness and vision problems. And that's a wrap. The subclavian artery is crucial for supplying blood to the brain, neck, and upper limbs. Understanding its course, branches, and clinical relevance is essential for your anatomy and cardiovascular physiology studies. Thanks for tuning in. Don't forget to like, subscribe, and hit that bell icon for more awesome anatomy content. Catch you next time.